I'm Ida Harris. I am the Director of Digital Content for Black Enterprise. And every day I'm tasked with bringing stories that are important to our communities. And I'm going to do nothing different today. And so I want to introduce a couple of superheroes. And yes, I mean superheroes. And Novartis has given us the opportunity to hear their stories. So first I want to introduce Martin Hamlet. Lindsay Livingston, and Tara Robinson. And so we're going to have this conversation about health equity and disparity, and each of these people have interacted with this topic in their work and in their actual lives and experiences. So thank y'all. So I just want to jump right into the conversation, okay? That's just kind of how I do it. Martin, could you share some of the insights of your role with Novartis?
No, thank you. Well, first and foremost, so glad to be here, right? Glad to be in a forum, in a venue that's progressive, innovative, energy, right? Thought leaders. This is not, what we say, the traditional venue that is in my career field. I'm newer to Novartis, going into my third year, but have a career in health equity. And for everyone that might not be familiar, health equity literally is just closing the gaps in what we know as chronic conditions, right? Whether it be diabetes or cancer, cardiovascular disease, infectious disease, that we just know that people of color, minorities, literally have worse health outcomes at just about every point, right? And so I've had a career and been fortunate to be a part of government and nonprofit organizations that help to close this gap, that come with community-based initiatives that really try to promote awareness and education, screening, to kind of get things from a traditional sense, right? We are communities of traditional foods and traditional caregiving and that sort of thing, but it's not necessarily always evidence-based and scientific. And so kind of that brought me and put me on the radar for Novartis, and glad to have joined their global health and sustainability team, which kind of seeks to find solutions to these problems.
Thank you for that. But tell me, we'd love to hear like some of the initiatives that you're leading over at Novartis.
Literally. So from starting with being one of the founding organizations going into the formation of Beacon of Hope, now helping to oversee cardiovascular programs. One of the largest is called Healthy Zip Codes. It's an innovative pilot that we're doing across 3 key cities, literally trying to close the gap in cardiovascular outcomes, because not only is cardiovascular disease the leading cause of death in the US, it's worldwide, right? And so it impacts all of us, whether you're a patient, a caregiver, employer, employee. So that's one of the largest that we have and that we're proud of at Novartis.
So I want to piggyback off of that cardiovascular conversation, because we have someone here who can kind of guide us through some of the information. I did a little bit of research and discovered that 60% of Black women are dying from heart disease. And most of those women are over the age of 20, and 20 is a young age. And Tara, you have the Black Heart Association, and you've endured 3 heart attacks in 1 week, y'all. Y'all hear that? And she's still here. And I want to turn it over to you, so you can tell us and share with us some of your superhero stuff that you're doing.
Thank you, Ida. Thank you, Novartis, for having me here as well. I would say everyone in this room knows someone with high blood pressure, diabetes, high cholesterol, highly stressed. We all know somebody, right? If not ourselves. And so for me, when my heart attacks caught me completely off guard in 2014, having one on April 10th, April 11th, and then a massive heart attack on April 12th. After going to the healthcare, doing all the right things, right, showing up when I'm in crisis and being sent home because of the color of my skin. Those are the things that I experienced during this whole ordeal. But after dying on April 12th, I went into sudden death that third time, and coming back here and realizing, why was I caught off guard when I'm doing all the right things? I'm going to the doctor, I'm eating right, I'm exercising, but yet it happened to me. And so at Black Heart Association is the company that myself and my husband founded to make sure that communities of color are no longer caught off guard as it relates to cardiovascular disease. Some people talk about it, but we're about it. We're about action. We make sure we're out in our community every single week, multiple times a week, screening and making sure people know where they stand as it relates to heart disease.
Thank you for that. And moving right along, right? Transitioning to another superhero, Lindsay Livingston, a breast cancer survivor. And I gotta tell y'all the stats on that. 41% of black women are dying from breast cancer. And that's 41% more than white women. And so between heart disease and breast cancer and all of the other illnesses that plague black people, I think it's time for us to kind of pay attention. And Lindsay, please share. Survive Her.
Bonjour. Thank you so much. Merci beaucoup to Novartis for this opportunity and platform. I was diagnosed with triple negative stage 2B breast cancer in July 2019 and underwent 15 rounds of neoadjuvant chemotherapy, a bilateral breast mastectomy, breast reconstruction. I learned that I carry the BRCA, BRCA1 gene mutation, and I also underwent fertility preservation before removing ovaries and fallopian tubes to reduce my risk of ovarian cancer. After those 15 months of a whirlwind, I realized through my own personal research and through my patient lived experience that I naturally pivoted into patient advocacy, just learning about the significant disparities that impact black women disproportionately at a higher rate. And as Ida mentioned, 40% of black women, or excuse me, black women rather, have a 40% mortality rate compared to non-black women. And 1 in 8, if you were to count for every 8 women in this room, one of those 8 persons will be diagnosed in their lifetime. It just so happened I was one of those 8. And so after undergoing all that I experienced, I felt a calling over my life to start an organization and a platform that would inform, inspire, and empower women about breast cancer awareness beyond the month of October. What month are we in right now? We're in June. June happens to be National Cancer Survivors Month. We actually just completed Black Family Cancer Awareness Week, which is a national platform to educate black people about the importance of genetic testing and early prevention. So the work that we do is supporting not only insured but uninsured women to get mammograms and screenings because early detection saved my life. We also empower our community to get genetic testing. How many of you have ever had a genetic test? So by the time you get back home to your various destinations, I implore you and I task you to schedule a genetic test so that you're informed with your predispositions and your hereditary risk so that you can make the best decisions for your life outcome. And so through Survive Her, we work year-round to save the lives of women who look like me.
Thank you. So Tara, I want to throw it back to you. Your organization was born out of the realization that black communities were silently battling and losing these fights against heart disease. Could you share how your partnership with Novartis came to be and why this collaboration is so crucial to your mission?
How our partnership came to be with Novartis. It was God sent, actually. I went to school with Marion Brooks. He was earlier the host of the panel. Hey, give a round of applause for Marion Brooks. He's doing great things at Novartis, and we appreciate him. And so I hadn't seen Marion in over 20 years. He has an awesome book out, and so I went to go support him in his book signing, and come to find out this is the world that he's in. And so I told him, hey, you know, I'm starting Black Heart Association, and I wanted to have an impact globally. And so it's because of Marion and Novartis and the work that they do as looking at community partners at the grassroots level is so needed in this time, not only for us to keep going and doing the work that we're doing, but be able to scale and go across the nation to do the work that we're doing. So in order to save lives, in order to impact our community, we need partners like Novartis, and so we're grateful to be here.
Thank you. And Lindsay, you recently engaged with Novartis, right, as a partner through your efforts with Survive Her. Why is it important for Novartis to continue holding platforms like we're having today? And why is it important for that partnership?
It's important for companies like Novartis to continue to hold forums of discussion to educate communities. There are three components that I think would be really helpful to share and modeling the work that Novartis is doing. Number one is providing access to comprehensive care. Novartis is really adamant about making sure that women have access to screening, early detection, and those various resources to help them live their, I like to say, breast healthiest lives. Research is so critical to our community. Investing in research that will lead to breakthroughs that can lead to positive outcomes for people of color. And number three is equity. Novartis is really, really big about equity and pushing that needle of equity to ensure that patients are communicated and delivered information that is culturally competent and culturally sensitive through compassion and with understanding and sensitivities. So Novartis, again, is leading the way, paving the way through health equity for communities of color. And I think they're doing a fantastic job. So kudos to Novartis, and thank you so much for being a Survive Her champion.
Yes, yes. So Martin, you didn't share any personal experiences, health experiences with us, but I'm sure you're an observer, right? Through your work.
Absolutely.
And so how is Novartis addressing disparities in the social determinants of health that impede the unmet needs of marginalized populations?
No, thank you. I think it's important to really, we can't emphasize enough how much Novartis gets it, right, from the top down. Like when we say community-based, and it's not just a tagline. I'm a HBCU grad. That was kind of important, HU love. But literally, the partnerships are key, because when you mention social determinants of health, there's just numerous studies, but 80 to 90% of your health outcome, right, how healthy you are following a chronic illness and the like, literally comes from your social environment, your the climate, your where you live, your housing, your transportation, your stress levels.
That zip code you talked about.
Literally, healthy zip codes, right? And so that's what we're penetrating kind of in an innovative stance, kind of proactive, to figure out where do we address and where do we focus for social factors. It's not just a therapy.
So we talked about how Novartis is facilitating, right? How does the community get involved? How do they connect with a Novartis?
Sure. I think the key is Novartis and others is to become aware, right? To increase your education levels as it responds to you as an individual, as it responds to community, as a caregiver, to take advantage of these resources, to participate in clinical trials, to get past the misnomers, and rightfully so at a particular time in terms of Tuskegee and the like, but we're beyond that, right? And so literally when we're researching drugs and the efficacy of drugs, how a particular therapy responds based off your genetic condition, literally enroll in clinical trials and participate, elevate your awareness and understanding of critical health issues.
Thank you. So I want to open it up. Please, y'all, take advantage of these people who are on the panel. Ask them questions. They have answers. So I'm going to pass it over to Monique.
Oh, here we go. I found my sound.
All right.
So thank you for that conversation. It's so important. Thank you, ladies, for what you've been through and sharing that and what you've created based on that. And Martin, thank you. Thank you for all that you do. I would love to kind of open up the floor for questions. I think it's not a common thing to have so many executives from one corporation in one room to share these things. And so just asking some questions, being engaged is an amazing thing. Even if you have questions for me, I'll come down there. But let's actually get some questions going. Okay, yes, ma'am. I'm coming back there right now. You want to go ahead and stand up while I'm coming to you? Oh, I'm going to take your fan too, girl. I needed to sweat a little today anyways.
How does it feel?
Yes, my steps. You look beautiful. Everyone looks so beautiful.
Thank you so much. Hi, everybody. Thank you for the conversation. My name is Aubrey. I'm an associate director of DE&I at Digitas, and I'm also a CCDC ambassador this year. Thank you. Thank you. I'm really inspired by all your stories. Lindsay, thank you so much for sharing your story. I was wondering, as a young woman, I feel like it's kind of hard advocating for yourself in the healthcare industry, so especially as Black women when they don't take our pain tolerance seriously. So I just wanted to know if there's any advice to advocating for yourself or searching for that right doctor, but really just kind of having that opportunity of education and that access to education, because I didn't know a lot of these things. I don't know what a genetic test is, but I will be getting one. So it's just it's kind of I don't know, you don't know what you don't know. So really just any best practices for, navigating that would be amazing. Thank you.
Aubrey, thank you for your question. I received that question a lot through Survivor, and my advice to you, if you are a woman who is under the age of 40, you're not mammogram ready, as they say, that I would continue to push back, and seek clinicians and providers of color. So I have a team of providers, and all of them are women of color, and so I think that has
That's
contributed
amazing.
to the reason why I was successful in my breast cancer journey. But Aubrey, I would just say, seek, if you can, if within your network, providers of color, clinicians of color, who will listen to you and continue to push back. If they say, no, we will not approve your breast exam, then you go to the next doctor and to the next doctor. That's one of the reasons why women of color are diagnosed too at a later stage, is because of dismissal in the healthcare system. But speak up, advocate, push back until you get that exam and until you get that appointment.
Thank you. Thank you.
And I want
Also,
to add to
I'll
that.
give you. Oh, go ahead.
I do want to add to that that any physician or doctor you work with, they work for you. Don't be afraid to fire them and rehire somebody else.
Well, also, I'll let you know that there is a platform called HUED, HUED, and they do have a directory of doctors who have either that are Black and brown, or they've gone through programming and certification for cultural competency. Yes. So we have another question over here, Miss Donnie. Stand up.
Thank you, thank you. My name is Donnie. I'm CEO of a global multicultural lifestyle media corporation. And we are in 200 countries and territories, reach about 9 million people, focused on 21st century cultural identity. And I used to be in the scientific space. I worked for Johnson & Johnson. Novartis was one of my competitors in pharmaceuticals. So my question stems from that, from both areas, actually. It's lovely to see all of you on stage, let me tell you. And so I'm wondering if it's a culture of inclusion from the get-go and from the top at Novartis. How do you think you all are able to thrive, not just from this stage, but the previous one? How do you think you're able to thrive in this corporation when it's very difficult to see a lot of people of color in leadership?
So I think I'll go. Thank you very much for your question and perspective. I think it is just that, right? It is a culture. It's genuine. And so in recruiting, I was on the outside in public health, in recruiting and attracting professionals that are in this space and passionate about this space, you get a sense from your earliest interactions that it is a genuine feeling, right? That this company is genuinely committed to improving. It's committed to listening and understanding, not just solving, dictating, and selling, if you will. And so I think it permeates in a lot of what we do. Marion and his team alluded to it in the first panel. They're excellent, right? It's just a culture that has professionals thrive over a much longer period of time than I've been here. But I think it's proof positive for his testimony and others like him.
Thank you, Martin. Are there any? Oh, yes, ma'am. Stand up, introduce yourself.
Yes, hi everyone. My name's Kemi. I'm from London and I'm a singer-songwriter and artist. I actually have a health condition called neurosarcoidosis, and I've been dealing with that for a few years. I was actually going to live in Barbados for a while to find like a holistic way because I've been having to do the pharmaceutical way, which is, especially for our people, it's not the right route. So I'm trying to find alternative routes now. And I just wanted to know if your company would, because I feel like there's more people that are aware maybe in America for our race and stuff. So I'm thinking internationally, how could people like me from different parts of the world get support, if that makes sense?
It does. I mean, I'm not as familiar. I'm out of Washington, D.C., but as you know, Novartis is based in Basel, Switzerland, and has a global presence. So I think probably, before this lunch session is over, we could connect with you directly to see what your interest may be.
Hannah's a good contact.
He said Hannah is a good contact. She's waving her hand.
There's Hannah. Hannah, stand up. She was on the panel earlier. Here, we're going to let you re-say that.
I mentioned it earlier, but it was one of the many things I said. But firstly, thank you. And secondly, I'm going to come and find you because we have presence in the US. The US is a huge market for us, but we're in 130 markets globally. One of them is the UK. So.
Thank you. And do you have a question? Okay, stand up and intro yourself.
My name is Moses, Dr. Edwin Moses from Morehouse. I did a little presentation here this morning. I don't know if this, it has to do with the dismal statistics with females losing pregnancies and having issues with pregnancies. I went to one of my colleagues from Morehouse is an anesthesiologist, his brother's a gynecologist, but he runs a foundation that deals with females, preeclampsia conditions, all these types of situations. And now the statistics are really, really coming out. It's my colleagues of mine like Allison Felix, the young lady that ran track and field that died in Alabama. I knew all these people. And so when they were having this discussion, I was there. It was more in Spelman's library. It was a very small attended session. However, and I was sitting there listening, one of the situations that really came up to me is that you hear a lot about preeclampsia. A lot of men don't know what that means. And every time there's a woman who's a mother, who's going to be a mother, there's always a guy in the background that has no idea of these type of things. In many cases, they have no idea of what a natural menstrual cycle is, what's normal for women, all these types of issues. And so my suggestion was, and I don't know if you deal with this directly, but just sitting here talking about inequity in especially women's health care, it seems to me that there ought to be a program that really educates young men as to what these conditions are, because I'm telling you, they don't know. They don't know. My son knows because I tell him, and his mom will tell him, but the average guy who's out here, who's going to be a father coming up in the future, they have no idea of the fact that high blood pressure, diabetes, all these kinds of things can severely, kill the mother and leave them with the baby. They have no idea. So that's just the comment that I have.
If I could add to that, Doc, I would agree with you. Heart disease across the spectrum is so dangerous for us because it doesn't look like anything. It looks like you and me sitting here. It kills more people more people than any cancer combined. And so when we talk about preeclampsia and knowing our risks, one of the tests that we offer is lipoprotein A, and in pregnant women, that's a genetic test, by the way, to let you know if you're at risk of ever having a stroke or a heart attack in your life based on what mom and dad left you. But when we talk about preeclampsia and those type of risks, having that test done, when you're pregnant, it doubles that number, or can triple that number in Black women or women across the board. So making sure your doctor understands where you are with your health, knowing your family history, getting genetic testing done, and presenting that to your doctor. So that's why it's important organizations like mine, Survive Her, exist, because we're out in the community having these one-on-one conversations. So making sure that you have a doctor that's also informed in the research as it relates to preeclampsia.
Thank you, Tara. Do you have a question?
That's Tara's husband.
Hi, my name is Frederick Robinson. I am the co-founder of Black Heart Association.
I think you have another important role too.
Oh yeah, my wife Tara. Yeah. I hold her. I carry her bags. My question is, as a black man in public health space, a couple of things we recognize is that one, we're not represented in the space a lot. Oftentimes when I'm out in the community with our Vehicle for Change program, I'm the only brother, I'm the only male out there. And two, it is a struggle to get brothers to come onto the mobile unit to get screened. We talk about health disparities, health equities, and all of these other things, but we know that black men are hanging out at the top of this list as well. I'm just trying to figure out, anybody on the panel, if you could lend some advice, how do we get brothers, how do we light a fire under our brothers as far as taking care of themselves, putting their health at the forefront of their thinking? How do we get these men to understand that you have to be well to be here for those that matter?
Yeah, no, I think it's a great point, and I would agree historically that there have been gaps. And I think when we looked at, okay, we got confetti. I didn't even finish. But no, I think historically, and if I could say from a public health perspective, I would contend pre-COVID it may have been. But when we looked at kind of COVID adherence and vaccine adherence and that sort of thing, we found that those numbers really weren't the case. That necessarily, there isn't necessarily a lag just between males and females, but the lag more had to do with those inputs and those barriers for getting health care. So again, it goes back to the social determinants. It goes back to Novartis's approach to have this holistic 360-degree view of approaching solutions that are long-term and sustainable, right? So you're not going to get improved health outcomes regardless of gender until you address housing, until you address transportation, health literacy, education, food insecurity, right? So I think those are the basis, and those are the areas of focus. Those are the drivers of outcomes. And so regardless of the population, whether it be children and obesity, and diabetes, whether it be on oncology, cardiovascular disease, the focus has to be on the 360-degree holistic approach for care.
Great answer, Martin. Do we have, oh yes, right here. You look nice and jazzy. You gonna stand up?
Hi guys, my name is Ibrahim. Question is, in the UK, for a lot of these tests, you probably have to pay for it. And then it makes me think about, basically only if you have the money will you be able to get these tests done. And then that's kind of like a barrier to entry. So I just wanted to ask if there's anything in place on a global scale from you guys.
Novartis, you hear that? We need a bus in the UK.
Yeah,
That's what he's saying.
yeah, that basically, not even just in the UK, but just actually allows those people who actually don't have the funds to go and spend. Because we just done a quick check, and to do some of the tests that you're saying, it might cost £350, but someone might not have £350 to go and check their health. So are there any things in place to actually help those kind of people?
I have some thoughts, but I think we can talk one-on-one once we leave here. There is a way that we can cross over internationally, so I just want to talk to you more after.
Do we have any more questions? Oh, okay. So I'm going to come here and then to you, and I think that we might have time for one more question after these two.
Thank you. Hello, everybody. It's a pleasure to be here. My name is Nana. I'm from the Gambia. And my question is, my sister is a sickle cell patient in America. She was actually born in she was born in America. I was born in Gambia. But we don't have the health care back home to deal with sickle cell or any of these diseases that affect black people. So she was born in, my mother made a decision for her to be born in America. I was wondering if Novartis is the right platform to really bring awareness to sickle cell, because it's really one of those diseases that affect black people, and if you talk about it, most people don't even know. And I'd wonder if that's something that you guys could consider.
Yeah, most certainly it does in the U.S., and then Hannah, as she knows, in SSA as well. So that is definitely a priority for Novartis.
Thank you. We have a question over here.
Thank you very much, and great panel, everyone. My name's Dudley. I'm from London, and I work across healthcare in various guises. 2 points I really want to make quickly. One of the issues we're having is actually when we look at definitely all the descriptions and the models and pictures, there's a lack of black images when it comes to black culture. And it's only of late, there's individuals such as Chidi Ibe and Joel Bivell who have been really making awareness in that space, which has been lacking. So that'd be one area to create awareness, especially what happens with skin conditions and so forth, and especially how we are with things like diabetes as well. The measurements and how they measure it is one thing. So how do we overcome that? And point two, how can we use and utilize the modern era of technology like AI to help us? Because I think that's the way forward, rather than just talking about it in the room. How do we actually utilize modern technology to help us going forward?
Those are amazing questions.
You want me to grab it? Okay. Great question, by the way, especially as it pertains to AI. At Black Heart Association, we hold a lot of data on our people, and we safeguard it, to be honest with you, to make sure it gets in the right hands and make sure it's used to help us and not to work against us. And so I think when we partner with each other and understand across cultures, that AI can be a powerful tool. So right now I'm currently partnering with another organization who is black-led in the cardiovascular space to work on how we can use AI to show early detections of heart disease. So I think it can be a powerful tool just in the right hands and not to be made used to work against us. Secondly, representation matters, and I think that's another reason why we think that none of this, like heart disease, especially heart disease, can happen to us as black people, because we don't see that on the screen, we don't see that on the paperwork that we pass out. But we have to be intentional, and when we work with companies like Novartis, we're sharing that voice, saying, I need this to look like my culture, the culture that I represent, because we have the trust. So that's why partnerships like this matter, so that we can bring our voices to the table and say enough is enough. It's time for our beautiful faces to be on the information that's being put out to our communities.
Thank you, Tara. Do we have any more questions? No? Okay. Well, Ida, I would love for you to leave just some type of one thing with everyone as a takeaway.
I thought about that earlier, and I'm a follow.
Of course you did, because you're a writer.
I'm a follow Miriam, right, with a quote from my favorite artist, Kerry James Marshall. And what he said was, if you want to play the game the way other people are playing, you have to play it at the highest level. And so and I think that applies to healthcare and black healthcare. If we're going to get this going and course correct, we have to play this in the same way that others are playing it to protect ourselves.
Thank you. Thank you to all the panelists. Thank you. As they're exiting,
I have a takeaway.
Oh, go ahead.
I want to share 2 takeaways.
Yes, Miss Linda.
Thank you. If you are...
Lindsay, I'm sorry.
Thank you, Monique. If you are 40 years old and over, and if you've not scheduled your mammogram, please schedule your mammogram. If you're under the age of 40, and if you have a family history of cancer, please see me. I can help you to learn how to advocate for the mammography or diagnostic test. And for everyone in the room, please look into, schedule a genetic test, or reach out to organizations like Black Heart Association, Survivor. We work with uninsured people to get genetic tests, mammograms, et cetera. So those are your homework assignments. Thank you so much.
And thank you for sharing
Lindsay.
your
And
stories.
then we should definitely get Miss Tara to do a takeaway, since we have a little time.
Right. My takeaway is that we're all at risk. And so to know where you stand and not let this thing catch you off guard is so important. Don't forget that heart disease is so deadly because, again, we look great. Don't we as black people? But again, it's killing us at alarming rates. And so remember that help is available for you. Just reach out. I'm one phone call away. Our website is www.blackheart.org.